The House will come to order. If there's no objection, we will revert to messages from the Senate.
Message from the Senate. Madam Speaker, I hereby announce the passage by the Senate of the following Senate file herewith transmitted. Senate file number 3878. Message is signed Cal R. Ludeman, Secretary of the Senate. First reading of Senate file number 3878, a bill for an act relating to transportation. Pursuant to Article 4, Section 19 of the Constitution of the State of Minnesota, Winkler moves that the rule therein be suspended and an urgency be declared that the rules of the House be so far suspended so that Senate file number 3878 be given its second and third readings and be placed upon its final passage.
Representative Winkler.
Madam Speaker, members, the Senate just passed this bill. This is the motion to suspend the rules in order to take it up immediately and to pass a bill that will save lives on Minnesota highways.
Any discussion to the motion? Seeing none, all those in favor, please say aye. Those opposed, please say no. The motion prevails. Clerk will give the bill its second reading.
Second reading, Senate file number 3878.
Second reading. There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate file number 3878.
Third reading. Discussion to the bill. The member from Nicollet, Representative. Wow, everybody's in a different place. Representative Brand.
Thank you, Madam Speaker, members of the House. This bill will allow the Commissioner of Transportation to access the Rural Transportation Infrastructure Fund in order to gain access to the funding needed to complete the final 12 miles of Highway 14 between Nicollet and New Ulm, Minnesota. I just wanted to take a moment to thank my co-authors. They include Representative Paul Torkelson, Representative Jack Considine, and Chair Frank Hornstein. Thank you very much. This is the Highway 14 bill. I urge your support with a green vote.
Any discussion? The member from Brown, Representative Torkelson.
Well, thank you, Madam Speaker. I'd just like to add my support to this bill. It's very important that we get this done quickly in order to have a better chance of accessing the federal grant. Thank you.
Any discussion to the bill? The member from Carver, Representative Nash.
Well, thank you, Madam Speaker and members. I will be voting no, and it's not because I don't support the bill. It's because I believe that we're here tonight doing something I think a little more important, and I think that this could be taken up at another time. So I will be voting no.
Seeing no further discussion, the clerk will take the roll on the bill.
Acom. Acom votes aye. Becker Finn. Becker Finn votes aye. Bernardi. Bernardi votes aye. Brand. Brand votes aye. Cantrell. Cantrell votes aye. Carlson A. Carlson A votes aye. Christensen. Christensen votes aye. Considine. Considine. Elkins. Elkins votes aye. Gruenhagen. Hassan. Hassan. Her. Her votes aye. Hornstein. Hornstein votes aye. Jordan. Jordan votes aye. Cleavorn. Cleavorn votes aye. Cagill. Cagill votes aye. Lippert. Lippert votes aye. Munson. Munson votes aye. Purcell. Purcell. Runbeck. Runbeck. Sandell. Sandell votes aye. Schultz. Schultz. Stevenson. Stevenson votes aye. Wozlowick. Wozlowick votes aye. Zhang Jie. Zhang Jie votes aye. Joachim. Joachim votes aye.
Does anyone wish to be recognized to change their vote? The clerk. The clerk will close the roll. 90. There being 96 ayes and 9 nays, the bill is passed and its title agreed to. Representative Winkler.
Madam Speaker, members, we're waiting for the next bill to come over from the Senate, and so I will move a recess to the call of the chair.
Representative Doubt.
Can't we just sit here?
Representative Winkler.
Would you like me to sing?
I agree with the recess.
Otherwise, I would recommend a recess, Madam Speaker. On my motion, we can sit and wait.
We could do the motion to suspend.
Does this qualify for the infection control act?
Who's making
How do you get the driest?
There's no objection. We'll revert to messages from the Senate.
Message from the Senate. Madam Speaker, I hereby announce the passage of this by the Senate of the following Senate file herewith transmitted. Senate file number 4334. The message is signed Cal R. Ludeman, Secretary of the Senate. First reading, Senate file number 4334, an act relating to public health. Pursuant to Article 14, Section 4, Section 19 of the Constitution of the State of Minnesota, Liebling moves that the rule therein be suspended and an urgency be declared, and that the rules of the House be so far suspended so that Senate file number 4334 be given its second and third readings and be placed upon its final passage.
Representative Liebling, to your motion.
Thank you, Madam Speaker. Members, this is indeed an urgency. This is the COVID-19 funding bill. I would ask you to please vote to suspend.
Seeing no discussion, all those in favor of the motion to suspend, please say aye. Aye. Those opposed, please say no. The motion prevails. Clerk will give the bill its second reading.
Second reading, Senate file number 4334.
Second reading. There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate file number 4334.
Third reading. I recognize the member from Olmsted, the author of the bill, Representative Liebling.
Thank you, Madam Speaker and members. Well, members, this bill is, as I said, indeed truly urgent. If you are watching the news, you know that we are potentially in a very dire situation in this state as in across our country and around the world. And we have the little bit of opportunity here to try to be more ready than some other locations that have experienced this. The previous money that we appropriated was to build up our public health system response. This second piece is to help our healthcare providers respond to the emergency. So what you see before you is kind of in two buckets. First of all, we're using our public health response contingency account, the same one we used for our previous appropriations, we're putting $50 million in that account with some new language that allows that to be used by the Department of Health for emergency funding. So we know that right now we emergently have to get money out to some of our healthcare providers so they can prepare for what is coming. Preparation can mean a lot of things. I know some members have talked to me about the need to reach out to certain communities to inform them about what's going on and help them to understand the health practices that we're all trying to engage in here in the House. That is included in this, as well as a range of other kinds of things. This is for consumable items, staff, training, things like that. It's not brick and mortar. So that's the emergency side of this. The second part of the bill is a fund called the Healthcare Response Fund and a provider grant program. So into this fund, we are putting $150 million this evening, and this will go out as grants to healthcare providers, which are very broadly defined in the bill, because this is an emergency that we really are having trouble predicting exactly where this is going to move and where the needs are going to be. But what this bill does is it allows the Department of Health to gather information from applicants, so healthcare providers can apply, do a simple application. This should be a pretty quick process, and that allows the Commissioner of Health to make some decisions and prioritize the need. Because even though it seems like we're putting a lot of money in this fund, the nature of this emergency could be that this fund is depleted pretty rapidly, and we'll certainly hope that isn't the case. But the commissioner is going to be able to look at the needs across the healthcare system. In other words, where we might need to build up our resources pretty quickly, whether the provider can be reimbursed from another source, and whether the provider lacks access to other resources to be able to immediately do the preparation that they need. So we hope that with this prioritization, we'll be able to make this money really work hard and do what it needs to do. In the bill, there's also a list of things for which the funds can be used. And then as a condition of accepting the grant, the providers are going to be asked to agree to a couple of things. One is that uninsured patients would not be billed for services that are provided for COVID-19. So no one in the state should need to worry, and these are going to go out very broadly, so most providers are probably going to have this at some point, and hopefully people without insurance are not going to have to worry that they're going to be billed for services under this, because we want people to go and get tested if they need to be tested, contact their healthcare provider if that is what they need, and access other services, certainly treatment if they need that. There was also language in the bill that Representative Schultz worked on to make sure that we don't have people run into a situation where they're out of network and suddenly end up with a large bill. So that is in here as well. And there's some reporting in the bill, and then there's also a sunset to the entire fund right now, and that sunset is June 30th, 2022. In addition, you may notice there's an Article 3 in this bill. This is an amendment coming over from the Senate. We thought it was a pretty good idea to expand the use of telemedicine in the state. So this also is a time-limited thing, but this would allow telemedicine to be used right from a person's home. So we think that at this time of crisis, that might be a very useful thing for people to be able to get access to the health care they need right from their homes. So that's the bill. Members would be happy to entertain questions. So I'll pause there. Thank you, Madam Speaker.
Discussion to the bill. The member from Carver, Representative Nash.
Thank you, Madam Speaker. And would the author yield?
She will yield. Representative Nash.
Thank you, Madam Speaker. Representative Liebling, could I ask you a question around the methodology that this will be distributed to different hospitals around the state? Because the hospital in my county, Ridgeview, is very important to our area, and I don't know the deliberation that went into this. If you could maybe help us understand how that is going to be decided upon, that would make me feel a lot better.
Representative Liebling.
Thank you, Madam Speaker. So there is a very well-coordinated kind of effort going on among our providers across the state, and they are talking to each other frequently, and there are regional groups that are coordinating. So the idea here is that the Department of Health is going to have to sort of do the overall coordination. They're in the best position to know what's going on in the system with consultation with all of these other entities. So they're watching very carefully to see where the needs are. They really know a lot in consultation with a lot of the hospitals where, who's prepared, who has needs, who might be a little bit in financial difficulty and not have a margin available to be able to do their own build out. And that's the intention here. So there's an application process, gathering of information. They're going to bring together their financial experts, their emergency planning experts, and they have a lot of expertise in the department, and they're going to quickly shift that into being able to do this and push out those grants. So I don't know if I can be any more specific than that, but the idea is that this money has to really stretch across all of our providers to make sure that we have maximum possible both readiness, but also as this thing goes on, it may turn out that there are clusters of cases in different places. We see in Washington State, there was a nursing facility that really got a lot of cases. So this gives both some analysis to be watching that, but also some flexibility to the department to make sure the resources go where they're needed the most. I hope that is helpful.
Representative Nash.
Well, and thank you again, Madam Speaker, and thank you, Representative Liebling. I guess my other question would be, you just described that they're going to be looking at the different hospitals and their needs. Is there going to be some level of, I don't know, throttling of the money from day 0 to day 20? Is it going to be, some held back in reserve so that if a future hospital may have a problem, that money won't be already exhausted quickly? Or what's the thought on that? Because again, if cases pop up in, say, Carver County or Roseau or wherever, and the money's already been spent, then we're going to find ourselves in a difficult situation. I was just wondering if you've anticipated that in the deliberations of the day.
Representative Liebling.
Thank you, Madam Speaker. And there was discussion about this. There certainly was. This is a situation where nobody can predict what is going to happen and where it's going to happen. That's just the reality of this. And, normally for us to appropriate this amount of money, this is a lot of money, $200 million we're appropriating here. We don't know if that's enough. It could be way too little. It could be more than enough. So I don't think there's any intention on their part to hold back money. In fact, as I described the bill, we have sort of this emergency pot of money, now $50 million. That's going to go out ASAP. So that's going to get pushed out really without the analysis and process that comes for the other $150 million. So the idea is we got to get on this now, and we can't wait to do tons of analysis. So that first money gets pushed out, and then there's more time to think about what happens later. So I wouldn't call that throttling. It's going to all happen pretty soon, but I'm sure they're watching very carefully where the cases are happening, where the serious cases are happening, because as you know, with this disease, a lot of people will have it and not even perhaps have symptoms or have very mild symptoms, but it's about, I think, 10% or 15% who could need hospitalization, and then maybe 5% who need ICU care. So the real problem that we have is we have to deal with all those levels. We're trying to still flatten the curve to keep people from becoming infected, to try to make sure that we don't overwhelm the resources of our system. And so this money kind of has to go in a bunch of different places. Testing, trying to help people, as I said before, understand what's going on so that they can try to protect themselves. All of those phases are going to be available. This money will be available immediately.
Representative Nash.
Well, and thank you, Madam Speaker. And Representative Liebling, last question for you, if you would continue to yield. I guess my other question is, the money cannot, as I read in the bill, be utilized to acquire things like respirators. And I'm maybe a little confused there, just trying to figure that out. And as the author, I thought maybe you could illuminate that a little bit for us.
Representative Liebling.
Thank you, Madam Speaker. I'm not sure it means that you can't use it for respirators. There was a lot of discussion about we don't want to just go and buy stuff for hospital systems with taxpayer money that then are going to become part of their income earning capacity when this whole thing's over, and we've just bought it for them. So I think that I and Senator Benson, the Senate author, really agreed on this. In our previous version of the bill, we had we had the ability to do loans for those kinds of items, because this thing could go on a long time. There may indeed be needs for hospitals to buy kind of equipment that stays, and they may not have the cash flow to do it. But as part of the agreement here, my loan fund went away, and there wasn't any interest in the other body in otherwise providing for those kinds of needs. So unfortunately, those kinds of ongoing items, whether it's, buying those really expensive ECMO machines and things like that, unfortunately, that is not in this bill.
The member from Blue Earth, Representative Munson.
Thank you, Madam Speaker, and Representative Liebling for putting this bill together. I know you put a lot of hard work into it, and we had some good discussion in the Health and Human Services Finance Committee. I do have a question for you, if you would yield for a question.
She will yield. Representative Munson.
In committee, I shared with you that I was the first suspected SARS case in Minnesota and was forced to go to HCMC and sit in a negative pressure room for 3 or 4 hours. And with that, upon leaving the HCMC, I got stuck with like a $1,200 or a $1,400 bill. So I do have concerns around the cost to people who have insurance, maybe with a high deductible. And I'm thankful that you did put in language in here that if they're receiving funds, that they have to charge you what they would have been paid in network. But it doesn't prohibit somebody with a high deductible from getting stuck with $1,000 or $2,000. And that was 17 years ago. I had a $1,400 bill, so it's obviously gone up a lot since then. And so I look forward to seeing if we can get Schultz's bill passed to cap those out-of-pocket costs. But this money, there's almost $250 million in this funding package for fighting COVID, and this money just goes to the hospitals and doesn't help patients. I know we're going to be seeing a lot of patients who lose their insurance because of the economic changes that are happening now, and so I have concerns about people with insurance, with high deductibles, and I wish that was in the bill. My question to you, Representative Liebling, is about the data. So we have all these applicants for the money, and then money's going to be dispersed to some hospitals, maybe not to Carver County. And after this is all said and done, when the money's gone, we want to look and see why did these hospitals get all the money, and some in these other areas didn't. So on page, where is it? On page 8, I think it is, where we look at the data that looks like the data is not going to be public. I'm sorry, on section, on page 7, lines 26 to in below, this appears to show that the data is not going to be public on the grant process. Is that your understanding as well?
Representative Liebling.
Thank you, Madam Speaker, and thank you, Representative Munson. Well, first of all, I just want to point out to your first comment that a lot of our health plans now are waiving the out-of-pockets for this emergency. So it's not uniform across all of them, but a lot of that is happening just because they're doing it. So, and Representative Schultz also does have a bill to make sure that that happens in all cases. So I do take your concern. It's just not in this particular bill. The question about the data, if you look at the bill on line 7.13, there's a section on evaluation report, and there is a requirement for the commissioner to do some reporting about what the grants are and how they go out and so on, and to put that on their website. So all of that will be available to the public to see where this money is going. Unfortunately, the data classification piece was changed by agreement in negotiations, not by me, so I can't really speak to that. As it went through committee, we did have more public data, that it became public after the grant was released, and that was changed just as a result of negotiations. So, you know, that I hear you on that. I think there's always a preference for having data be public if it's not, you know, a good reason to be private, and it's kind of, this is just where it ended up, so.
Representative Munson.
Okay, thank you, Representative Liebling, and thank you, Madam Speaker, for the time to speak about the bill.
The member from Scott, Representative Albright.
Thank you, Madam Speaker. Would Chair Liebling yield for a couple questions?
She will yield. Representative Albright.
Chair Liebling, thank you for the effort that you put forward. I know that it's been an undertaking to put this together. Recently, the President put together some initiatives with regard to waiving and grant programs, about, I believe it was $50 billion, of which the state is due to receive, I believe, about $50 million. And I'm just wondering, in terms of usage of that money, is this program that we're talking about now secondary to the use of the federal money, or how would you believe, and I'm not going to hold you to an answer, but from what you would understand from previous situations like this, would the federal money be used before the state money?
Representative Liebling.
Thank you, Madam Speaker. Representative Albright, there's a section in the bill that starts on line 7.2, assistance from other sources, and it really does address this. So absolutely, if they get other money, the federal money gets used first. And by the way, we just got $10 million, so we did receive that. But you know, sometimes it's a little hard to predict when federal money is going to get to us, and we certainly can't wait for it. The urgency of the situation means that we need to put forward the state funding that we can right now. But yes, absolutely, under this section, you can see that if they receive funds from a non-state source, then there's an ability to, they have to notify the commissioner, and the commissioner can take back the extra money. So absolutely, we want to use the federal money if we do get it.
Representative Albright.
Thank you, Madam Speaker. If Chair Liebling would continue to yield.
She will yield. Representative Albright.
Thank you, Madam Speaker. Representative Liebling, you mentioned in a response to Representative Nash's question about the analysis done, and you articulated the first $50 million, there won't be as much analysis done on that money, that it'll be pushed out pretty quickly. That strikes me as a bit uncomfortable from the perspective of not knowing what it's for and having some accountability measures. I know that's not what you meant, so I'm hoping that you can clarify that statement and just give the body, as well as myself, some reassurance in terms of what the process would involve with dispersing that first $50 million in terms of, is there a prioritization for test kits? Is there a prioritization for some of the other first line of triage type of elements to this defense of this virus? I'm just hoping if you could elaborate on some of those points. Thank you, Madam Speaker.
Representative Liebling.
Madam Speaker, Representative Albright, so the reason that we did it this way, structure in these two buckets, is because unfortunately we're in a situation where we have to make some very quick decisions. And so that's why, if you look in the bill, we did add language that lists what the money can be used for. So it can't just be anything. It has to be, you know, closely related. There is a lot of flexibility, but the things are listed in here to try to do some guidance on that. But indeed, this is not a comfortable thing to do. I'm with you on that. And even this process we're pursuing here is not a comfortable process. Unfortunately, the situation we're in is not a comfortable situation. And it's the urgency of this issue that is driving us to have to do it this way. And I certainly would prefer not to. I know most of the members here would prefer not to. We don't like to hand out money and just say, we trust you, go and do what you need to do. But we do know that we have great need, and that if we don't get our system going and get the resources where we need them, we can be in deep, deep trouble. I mean, we may be in deep, deep trouble anyway, but we're trying to mitigate that with this. So that's why we've divided it up like this. I don't know if it's the right amount. I started out with a smaller amount in the emergency fund, but as we look at the news every day, and as now we're up to, I think, 54 cases in Minnesota, it's growing really rapidly. And we now have community spread in Minnesota, which means cases that are not obviously linked to travel or something like that, where it's not obvious, you know, that somebody came in from China and was exposed there or something. So the situation, when we look at other places and how this is spread, it's really very dire. So I regret that I can't tell you and give you more comfort about the money being this first $50 million. I do feel much more confident about the rest of the money, because I think there will be much more analysis and kind of looking at the system and where there are gaps, and we'll be able to see what the trajectory of the disease is and so on. But this first 50, we did our best to put some guidance here in the bill, But knowing what we know about what's happening and what's going to happen, I think that we're just in a situation where we just plan for the worst and hope for the best.
Representative Albright.
Thank you for that, Chair Liebling. If she would continue to yield.
She will yield. Representative Albright.
Thank you, Madam Speaker. Chair Liebling, I also share the concern that Representative Nash expressed with regard to the need for ventilators, ECMO machines, that type of thing. We're, as you said, dealing with the unknown, and we really don't know where those needs will be appreciated more than at the moment that they are needed. Are you of the impression that there are other reserves of funds or in consideration of a rural hospital that might need additional ventilators or an ECMO based upon the severity of the outbreak in a certain area? Is there some thinking on your part and on the part of others that MDH or DHS also has this in the top of mind, that if this were to occur, that those types of pieces of equipment, appliances might also be available to them through some type of a grant program, because we all know the kind of the fragility of some of these balance sheets in these greater Minnesota hospitals. What is your thinking in terms of what might be possible if not through this grant program? Thank you, Madam Speaker.
Representative Liebling.
Thank you, Madam Speaker, and Representative Albright. I'm not so sure that ventilators are excluded here. I think the ECMO machines probably are, but let me tell you what I learned about that is that there really aren't many of them available. I think the problem we're going to have more is that these things just may not be available. There's a supply chain issue, and they are so in demand worldwide. So it may not be just a money issue, it may be a resource issue. But money is fungible. So if some of these hospitals are getting help with some expenses, they may be able to shift some of their resources to other things too. So there's that. I really wanted to have a loan program for exactly that reason. And I'm not so concerned about, the small hospitals. I think they're going to have a lot of needs, and I think we're going to be able to do a lot to help them out under this bill. I really do. This is really kind of how it's designed. We also wanted to strike a balance. We're dealing with public money here. We worked hard to strike a good balance because we don't want to have a situation where we're also kind of freaked out that we just start throwing money everywhere. We can't do that. We're stewards of public money. At the same time, we have to make sure that we are doing what we need to do to make sure that our health community can be prepared. So we're trying to thread that needle. I don't know if we did it perfectly, but we sure have tried. And I hope we don't have to come back here and appropriate more money. But if we do, we'll certainly maybe have a better, maybe we'll have a better idea at that time of what the equipment needs are and what the availability of that equipment is, and we'll be revisiting this, I'm sure.
The member from Stearns, Representative O'Driscoll.
Thank you, Madam Speaker and members. This is not where I wanted to be at 3 o'clock in the morning on Tuesday on St. Patrick's Day, but I will wish all of you a happy St. Patrick's Day. I'm wondering if Representative Liebling would yield, please, to a few questions.
She will yield. Representative O'Driscoll.
Thank you, Madam Speaker. I want to go back to some of the topics that were discussed here because I don't have a comfort level with them. In the area of the part of the state of Minnesota that I hail from in central Minnesota, the St. Cloud Hospital is a level 2 regional medical center. And what does that mean? It means that when you have critical cases at other hospitals, St. Cloud is the landing pad. So if Douglas County Hospital in Representative Franson's district has an issue, they're transported to St. Cloud. In Representative Krisha's district, if you have a situation where St. Gabriel's Hospital is unable to take care of it, they are transported to St. Cloud. In Representative Damon's district, Painesville Hospital, Same thing transported to St. Cloud. My fear is that because of the dense population in the cities of Minneapolis and St. Paul and Ramsey and Hennepin County, that because of the closeness of people, you're going to have a larger number of people who are going to need services. But if you look just to the north of the metro area where St. Cloud is, you have a lot of interaction with St. Cloud residents because of work and other in this area. So this virus could, as we've talked about, be passed in the community. And I fear that there's going to not be money left over unless we take a portion of that money up front and know that it needs to be dedicated to Greater Minnesota. I can make that same case for Mankato, Representative Constantine's district, with I believe it's the Emmanuel St. Joseph's in there. Same story, community hospitals. How do we take care of those folks if we blow through $2 million of money in the Twin Cities metro? Because it's going to be a wave effect. You're going to see it more in the metro area and carrying out to Greater Minnesota. How do we today provide those folks, Representative Liebling, a sense of comfort that that's going to have money available in 3 weeks, 4 weeks, 5 weeks when it begins to manifest itself more in Greater Minnesota than it does in the Twin Cities area?
Representative Liebling.
Madam Speaker and members, this is an issue that we wrestled with a lot. How do we decide, or who should decide? How should it be decided how these resources go out? And there's no perfect answer to that, Representative O'Driscoll. There just isn't. My personal feeling is that we in the legislature are really not in a good position to say, oh, this hospital should get this and that one should get that. And there are people who are working on this. We have people working on emergency preparedness. We have an excellent Department of Health, and they are working really hard, probably night and day, honestly, to try to figure out how to do the best for the people of Minnesota. We know that when it comes to stuff like this, and I would argue a lot of other stuff, we are really closely connected. What happens in your district affects my district, affects all our districts. And this virus and this emergency is going to show us just how connected we are. That's why we're sitting here 6 feet apart, right? We're trying to loosen those connections a little bit. So I wish I could give you comfort and tell you that, oh, it's going to be fine. We're going to be able to take care of your district and your district and your. I don't know that, but I do know that the people who work for us in the Minnesota Department of Health are really fine people. They know what they're doing. They're hardworking. They have the interests of this state at heart. And they're working with people from all over the state. There are these regional planning teams, and they're engaged with all of them. This is not going to be like, oh, here's a pot of money, we're going to spend it on this one thing. That is not, they don't know how many grants they're going to be, but they're going to respond to requests. And it's not going to be a typical grant process, which is kind of a long, drawn-out thing. But it's going to be a simple application, explain the need, and the people in the Department of Health know our hospitals and know our healthcare system pretty darn well. They have people who interact with all of the hospitals and all of the players in the system. And when at the end of the day, we kind of have to trust them. We kind of have to trust them because somebody has to make these decisions. I don't think it can be us, not only because we're a political body, and this cannot be a political thing. This has to be about health and needs of Minnesotans, not about politics, and I don't think it has been to this point, and I'm very grateful for that. It can't be about politics. Somebody has to be orchestrating this thing to make sure that the resources go where they need to go. Somebody has to do it. And if it isn't the Department of Health, I don't know who it would be. And I know that there are different levels of comfort among members. We had this discussion as we were negotiating the bill with the Senate. At the end of the day, we got to trust them because we have no other choice. We have an excellent Department of Health. We really do. I have spent many hours with a lot of the people from that department. And I feel very confident in their integrity and their concern and their abilities. So that's the best I can tell you. I wish that, you know, we are all feeling really on edge. I don't know about you, but I've just had a roller coaster of a day, emotional day. And I'm willing to bet that probably a lot of you on this floor had the same. Just because of the situation we're in. We're concerned about our own families. We're concerned about our districts, ourselves, our parents. You know, there's a lot of reasons to be worried. We're all really on edge, but at the end of the day, we gotta use the tools we have, and we have a very fine Department of Health.
The member from Hennepin, Representative Bowe.
Thank you, Madam Speaker. Actually, the member from Carver.
Sorry, Representative Bowe.
It's musical chairs, which makes it kind of challenging tonight. Would Chair Liebling yield for a question real quick? Thank you.
She will yield. Representative Bowe.
Very good. You mentioned something when you were talking earlier about how this bill will expand telemedicine, and I wondered if you could tell me just a little bit more about how telemedicine would be utilized and how that would expand in this bill.
Representative Liebling.
Thank you, Madam Speaker. So this is an amendment that came from the Senate, and it's on the very back of the bill. You can read the language, and the main thing that it does is it allows a patient's home to be used as a site for telemedicine. So right now, the language in the law says that it's got to be, I forget, it's got to be some kind of a special site where the person has to go to participate in telemedicine. This allows them to do it right out of their home. And it also says that health carriers have to allow that to be paid for, even though it's telemedicine. So that's kind of a big piece of this here too. And we'll see how it goes. It sunsets, this thing expires February 1st, 2021. So we'll have a little chance to see how it works and then see whether we want to continue it.
Representative Bowe.
Thank you, Madam Speaker. I would just remind the members that telemedicine can be a two-edged sword, and while it does provide convenience and it does allow folks to have other options, I think number one that the shortfall that we're going to be facing here will be equipment in the hospitals or certainly in the homes rather than a lack of doctors. The negative to telemedicine, while it does provide a positive of convenience, the negative is that telemedicine can help good-paying jobs to migrate away from our communities and migrate away from our state and migrate out of our country even, in fact. So we should be careful before we just openly embrace telemedicine. Thank you.
The member from Goodhue, Representative Haley.
Thank you, Madam Speaker. Would Chair Liebling yield for a quick question?
She will yield. Representative Haley.
Chair Liebling, first of all, thank you for all your hard work. I heard a few iterations in committee, so I am in support of the bill. A quick clarification, the bill calls for reimbursement through this grant process for screening and testing. And earlier when this, some of the pandemic started, we were told by the major health care providers that they would cover screening and testing. So I just would like you to clarify any overlap and how you see that working in your bill.
Representative Liebling.
Thank you, Madam Speaker. There's language in here, and I think I pointed it out to another member, that this is not meant to be used if the entity has other funding. So this would not in any way replace that, and it's really not meant for things that they can bill for. So reimbursement is on the back end when they've already spent the money, they get reimbursed. This is for pushing money out for expenses on the front end. A very important distinction. Thanks.
Representative Haley.
Thank you, Madam Speaker, and thank you, Chair Liebling. And Madam Speaker, I'd just like to make another comment. Again, thank you, Chair Liebling, and the work in the Senate, and particularly to all our staff. I know it's been a long day for you. And again, I am in support. I would like to call out one thing that concerns me, and I want to make this point in the case that if we have to come back and provide more money to these funds, that we possibly can consider this item. And I'm concerned about the cost shifting. I appreciate that we want patients to not worry about what healthcare facility they go to when they need care, and I appreciate that these grants cover the uninsured. But in many regions of our state, particularly outstate Minnesota, particularly southeastern Minnesota, we have a very high percentage of public pay patients, up to 70%, and versus 30% private pay. The private pay patients are not covered in this legislation, and I'm concerned about the high cost of covering care for this disease, this pandemic, and the potential long-term cost shift and what that will do to our insurance rates. So again, if we are in the unfortunate position of having to come back and expand this legislation or provide other funding, I'd look for some safeguards, maybe some auditing or additional reporting so we can be prepared and aware of the cost shifting that could occur. Thank you, Madam Speaker.
The member from Hennepin, Representative Robbins.
Thank you, Madam Speaker. Thank you, Chair Liebling, for your hard work on this bill. I know it's been a long day. I just have two quick questions. First, in the fund on line 3.24, it talks about using some of the money to administer the grant program, including carrying out the duties. And I just wondered if you have any thoughts about how large of a staff that will be required to run this grant program and how much it would cost.
Representative Liebling.
Madam Speaker and Representative Robbins, I really don't. You know, this was in here. It was kind of going to be talked about. It really didn't get a lot of discussion. The idea, and I have not heard from the department that they're going to go and hire a bunch of people. What they're going to do is shift them from other duties, and that's kind of what they've been doing in this whole emergency. They're a small department, so they're going to bring in their experts to do this, but it's obviously going to cost something. So I think we'll get reporting on that, but I'm sorry, I really don't know what this could be. And again, even this piece of it, I know we always want our agencies to be frugal. We don't want money that we appropriate to go, you know, for the administrative piece, but there are so many unknowns in this that it's hard to know if they're going to push out lots and lots of small grants or several big ones.
Representative Robbins.
Thank you, Madam Speaker. Thank you, Chair Liebling. If you would have just one more question. I was curious why in the first section, the grant program expires on June 30th of 2022, but the telemedicine expires next February 21st of 2021. And it seems like an extra year and 5 months on the grant program seems a little long if we follow the course of how the pandemic seems to be going. It seems like we'll be well past it by then. So I just wondered if you could explain why the grant program expires so far into the future. Thank you.
Representative Liebling.
Thank you, Madam Speaker. If I had my druthers, I wouldn't have had it expire. So that was a compromise with the Senate. The idea is, I think by that point, we'll know what's going on. And if there's money in this fund and the pandemic's over and we don't need it, we can just take it out of the fund. We won't have to stay there. So I think this is the idea, is the fund is there long enough for us to get a pretty good idea of what we're going to need. In terms of the other, sunset on the telemedicine lines up with the sunset actually on the other funds that we appropriated that the Senate insisted on, so it's kind of parallel with that. And again, we'll be in session at that time and we can evaluate whether we think this is something that should be extended or not, because obviously from the other member who spoke, it's, you know, this is something that we need to examine. It's a mixed thing and deserves close examination.
The member from Scott, Representative Cantrell.
Thank you, Madam Speaker and members. And I rise today to speak in favor of Chair Liebling's bill. There will be few votes that I think any of us will ever take or that any legislature to ever sit in this chamber will ever take than the one that we are contemplating this evening. As we assess what is a heretofore unexperienced pandemic sweeping through our country and our state, The leaders in our legislature, like Chair Liebling, have stepped up to ensure that we create a foundation upon which the folks in our state, patients, healthcare providers, and hospitals may know some semblance of stability in an otherwise frightening time. This bill prioritizes some of the most vulnerable in our state. It prioritizes care providers, suburban, urban, rural, and with a great focus on ensuring that the cost of care, that the specter of uncompensated health care bills does not propagate in any significant way this pandemic, this virus within the state of Minnesota. Members, I urge you to please support this bill. Please vote in favor of Minnesotans. Please vote in favor of ensuring that our hospitals and our providers get the resources they need. Thank you, Madam Speaker. Thank you, Chair Liebling.
Any further discussion? Seeing none, the clerk will take the roll.
Acom. Acom votes aye. Becker-Finn. Becker-Finn votes aye. Bernardi. Bernardi votes aye. Brand. Brand votes aye. Cantrell. Cantrell votes aye. Carlson A. Carlson A votes aye. Christensen. Christensen votes aye. Elkins. Elkins votes aye. Grunhagen. Grunhagen. Hansen. Hansen votes aye. Herr. Herr votes aye. Hornstein. Hornstein votes aye. Jordan. Jordan votes aye. Cleavorn. Cleavorn votes aye. Cagle. Cagle votes aye. Lippert. Lippert votes aye. Sandell. Sandell votes aye. Schultz. Schultz votes aye. Stevenson. Stevenson votes aye. Tabke. Tabke votes aye. Wozlowick. Wozlowick votes aye. Zhang Jie. Zhang Jie votes aye. Joachim. Joachim votes aye.
The clerk will close the roll. There being 108 ayes and 0 nays, the bill is passed and its title agreed to. Announcements. Any announcements? Representative Winkler.
Madam Speaker and members, I think it would be appropriate for us to just take a moment to thank the chief clerk's staff, the sergeant at arms, and the sergeant at arms staff.
Members, if I could just, I know this is not proper, but they have worked so hard to make sure that we can be safe while we work here. And I would ask each and every one of you to work as hard at keeping them safe as they're working at keeping you safe. Representative Winkler.
Madam Speaker, I move that when the House adjourns today, it adjourns until 12 noon, Tuesday, April 14th, 2020, or until a time and date determined pursuant to House Concurrent Resolution Number 3.
Representative Winkler has moved that the House will adjourn until 12 noon on Tuesday, April 14th, or until a time and date determined pursuant to House Concurrent Resolution Number 3. All those in favor, please say aye. Aye. Those opposed, please say no. The motion prevails. Representative Winkler.
Madam Speaker, I move that the House do now adjourn.
Representative Winkler moves that the House do now adjourn. All those in favor, please say aye. Aye. Those opposed, please say no. The motion prevails. The House stands adjourned until 12 noon, Tuesday, April 14th, 2020, or until a time and date determined pursuant to House Concurrent Resolution Number 3.